Ever been watching your dog chase squirrels or, you know, your cat just lounging in a sunbeam and suddenly thought, wait, is there something different about their eyes?
Yeah.
Maybe like a subtle haze you hadn't seen before, or maybe a slight change in color that just catches your eye?
Uh-huh.
Well, that kind of observation. That's what kicks off our deep dive today. We're zeroing in on two specific eye conditions that might be behind those changes.
Hmm.
Hypopyon and lipid flare.
Exactly. And we've got some really interesting stuff to unpack here that will help you understand what might be going on if you do notice something like that.
Right.
Think of it as getting a bit of an inside look, at what could be happening in your pet's eyes. We'll explore the underlying causes, what sparks these conditions in dogs and cats, how vets diagnose them, and the typical treatment strategies.
And for you listening, the real power here, I think, is the knowledge. Understanding these conditions better means you'll be more likely to spot potential issues early. And you can have more informed conversations with your vet. We're going to try and cut through some of the medical jargon, highlight the key things to know so you feel more confident recognizing when it might be time to, well, seek professional advice.
Sounds good.
Okay, let's dive in, starting with hypopyon.
Okay, so hypopyon. At its most basic, it's a collection of white blood cells in the front part of the eye. That space is called the anterior chamber.
Okay, the front chamber.
Right. Imagine that normally clear space kind of filling up with these cells. What's fascinating really is how it usually starts. It's typically inflammation inside the eye. The technical term is uveitis.
Uveitis, got it.
And this inflammation, it messes with something called the blood aqueous barrier. Think of this barrier like a really selective filter. It usually keeps blood stuff out of the eye's fluid.
Like a bouncer at a club.
Exactly. But when it's inflamed, that filter gets leaky, and it lets white blood cells rush in.
So it's not just a random flood, is it? It's more like the eye is signaling for help.
Precisely. The inflamed eye releases these chemical signals. They're called chemoattractants, little emergency flares, you could say.
Okay.
They call in the white blood cell first responders to the area. Now, here's the thing. Gravity plays a role. These cells tend to settle down at the bottom of that anterior chamber.
Ah.
So a vet looking closely might see this distinct white or maybe yellowish layer pooling right at the lower part of the eye.
Kind of like sediment settling in water if you leave it undisturbed.
That's a perfect analogy, actually. Yeah. It can be a thin layer right at the bottom, or, in more severe cases, it might fill the entire front of the eye.
Wow.
And here's where it gets a bit more complex. Sometimes this protein called fibrin can also build up in that space.
Fibrin, like what helps blood clot.
Kind of, yeah. And this fibrin can form this sticky sort of network. It basically traps the white blood cells, preventing them from settling neatly at the bottom.
So they're suspended.
Right. They might appear suspended, caught in this fibrin web. So while typical hypopyon gives you that clear, distinct line at the bottom, like settled sediment.
Like that horizontal line you mentioned.
Exactly. Fibrin makes it look more diffuse, maybe uneven, like the sediment is all mixed up and caught.
Okay, so you wouldn't see that sharp line then.
Probably not as clearly, no. And along with this visible buildup, there are usually other signs, telltale signs.
Like what?
Well, you might see your pet squinting a lot. That's called blepharospasm.
Squinting, okay.
Or maybe excessive tearing, which we call epiphore, the cornea, the clear front surface.
Yeah.
It might look cloudy. That's diffuse corneal edema. Then there's something called aqueous flare. It's like seeing dust motes dancing in a sunbeam.
Uh-huh.
In the eye, it means there's protein floating in the fluid, making it look hazy when the vet shines a light through it.
Okay, so hazy fluid.
Right. You might also notice the pupil looks smaller than usual. That's meiosis, swelling of the iris, the colored part, and understandably, maybe some vision loss.
That paints a pretty clear and frankly uncomfortable picture of what hypopyon involves. So what usually causes this? What's triggering all that inflammation?
Well, the most common trigger is really any condition that leads to that internal eye inflammation, the uveitis we talked about.
Right.
It's often linked to more severe cases of uveitis. But it's also important to know, though it's less common, that sometimes a buildup of abnormal cells, like in ocular lymphoma, can look like hypopyon too.
Okay, so inflammation is the big one, but other things are possible. Now let's switch gears a bit. Let's talk about lipid flare. It sounds kind of similar, just based on the name, and how it affects the eye's appearance.
It can look similar superficially, yeah, but the why behind it is totally different. Lipid flare gives that anterior chamber a cloudy, almost milky look all
Oh,
over.
milky.
Yeah, diffuse and milky. And it's not white blood cells this time. It's because there's a high concentration of lipids, fats in the aqueous humor, that fluid in the front of the eye.
In the eye fluid.
Exactly. And what's particularly insightful about lipid flare, I think, is that it can often be like a little window into your pet's overall metabolic health.
How so?
Well, unlike hypopyon, which is more directly an eye inflammation issue, lipid flare can be a really strong clue about underlying problems. Things like diabetes or high cholesterol that you might not even know were there.
Huh. So the eye issue is actually pointing to something systemic.
It often does. So it's like the clear fluid in the eye itself becomes fatty, almost like, well, like you said, milk mixed with water.
Oh.
And for this to happen, generally two things need to be going on at the same time. First, just like with hypopyon, you need that leaky blood aqueous barrier
Right.
that lets the lipids from the bloodstream get into the eye.
Right, the leaky filter again.
Yep. But the second crucial factor is concurrent hyperlipidemia. That just means abnormally high levels of fat in the blood itself.
So if a pet already has high cholesterol or triglycerides for some reason, and then something causes that eye barrier to leak.
Bang! Perfect conditions for lipid flare. Now, in terms of other signs you might notice, they can sometimes be a bit less dramatic than with hypopyon.
Milder.
Often, yeah. You might still see some vision loss, maybe some mild squinting, and mild to moderate cloudiness of the cornea itself. But often not that intense pain reaction you sometimes see with severe uveitis.
Okay, so we've got these two conditions, hypopyon and lipid flare. Both can make the front of the eye look cloudy or opaque. How do vets actually tell them apart? What are the key differences they're looking for?
Yeah, that's where a really careful eye exam is critical. One of the main giveaways with hypopyon, as we said, is when those white blood cells settle out due to gravity. You often see that clear horizontal line of white or yellowish stuff at the bottom of the anterior chamber.
The sediment line.
Exactly. That's much less likely with lipid flare, which usually has that more diffuse, consistently milky appearance throughout the whole chamber. Now, we did mention fibrin and hypopyon can mess with that line.
Right, make it less distinct.
Yeah, but even then, the overall appearance tends to be different from the sort of uniform milkiness of lipid flare.
That makes sense. So the pattern of the cloudiness is a big clue. What else helps distinguish them?
Well, both can involve that aqueous flare, the protein haze in the fluid. But severe aqueous flare doesn't usually have that really milky or bright white look that's so typical of lipid flare. It's more of a haziness.
Got it.
Also, animals with really severe aqueous flare often seem more obviously uncomfortable or in pain compared to those with just lipid flare.
Okay, pain level is another clue.
And finally, sometimes that cloudiness on the cornea itself, the corneal edema, can maybe be confused with opacity inside the chamber. But a careful exam will usually pick up other signs specific to corneal problems. Things like the cornea looking thicker than normal, maybe an abnormal bulge, which is called keratocomorse, or even tiny fluid blisters on the surface, known as corneal bullae.
So it's not just the cloudiness, but where it is and what else is going on in the eye structure.
Okay, so let's say you bring your pet in with these signs. What happens next? What's the diagnostic process like?
Well, a basic physical exam is always the first step, naturally, but that often won't tell us the specific underlying cause, why the hypopyon or lipid flare is happening.
Right.
For hypopyon, routine blood work is usually done, a CBC, blood chemistry, maybe a urinalysis.
It's standard stuff.
Pretty standard, yeah. And interestingly, these might actually come back completely normal, especially if the hypopyon is clearly linked to something local in the eye, like a corneal ulcer.
Oh, okay.
But if the hypopyon looks like it's due to uveitis, that internal inflammation, then those same tests might show abnormalities. Clues that point towards a bigger systemic condition causing the eye inflammation. So the blood work can be really informative about the bigger picture.
And are there any lab tests specifically for hypopyon itself?
Not really, no. Not if the vet can clearly see, say, a corneal problem causing it. Then the focus is just treating the cornea.
But if uveitis is the prime suspect, then yeah, the vet will likely want to dig deeper. More tests to figure out what's causing the uveitis. That could mean more specialized blood tests, maybe imaging, depending on what the initial exam and blood work suggest.
Okay.
In pretty rare situations, if there's a strong suspicion of something like cancer cells causing it, like lymphoma,
Right, you mentioned that possibility.
yeah, then the vet might perform a procedure called anterior chamber centesis, basically carefully taking a tiny fluid sample from the front of the eye to look at under a microscope. But honestly, that's generally not needed for most hypopyon cases.
Okay, that makes sense. What about diagnosing lipid flare then? Is that process different?
It is, yeah. Because lipid flare is so directly linked to high fat levels in the blood work becomes even more central to the diagnosis.
Ah, okay.
You'll almost certainly see elevated levels of serum triglycerides and cholesterol, high fats.
So the blood test points right to it.
It strongly suggests it, yeah. These findings really point towards an underlying metabolic disorder causing that hyperlipidemia. So in these cases, the vet will definitely recommend more tests specifically aimed at figuring out why the fat levels are so high.
Right, getting to the root cause of the high lipids.
Exactly.
So blood work seems really crucial for both, but it's perhaps even more directly diagnostic for lipid flare. Okay, let's shift to treatment. Once a diagnosis is made, what are the typical game plans?
Okay, treatment. The absolute most important thing to remember for both conditions is that just treating the eye symptoms isn't enough. You have to find and address the underlying cause, too.
Right, treat the cause, not just the sign.
Precisely. For Hypopyon, the main goal is to really aggressively treat that uveitis, the inflammation causing the cells to flood in. And usually, this can be managed as an outpatient. Your pet likely won't need to stay at the clinic.
Okay, and what kinds of medications are we talking about to fight that inflammation?
Corticosteroids are definitely a cornerstone of treatment. These can be given topically, right into the eye as drops. Things like prednisolone acetate 1% or dexamethasone 0.1%.
Standard anti-inflammatory eye drops.
Yeah, they're often the first line because they deliver the medicine right where it's needed, usually with fewer body-wide side effects. How often you give them depends on how severe things are. And then, as the eye improves, the vet will have you slowly reduce the frequency that's called tapering.
Tapering off. Got it.
Sometimes the vet might also give an injection of corticosteroids just under the conjunctiva, the surface lining of the eye. Medications like triamcinolone or methylprednisolone.
An injection in the eye. Sounds intense.
It sounds worse than it is. It's usually a one-time thing that provides a longer-lasting anti-inflammatory effect, and it's often followed up with other meds, like drops or pills.
Okay.
For more severe cases, or sometimes alongside topical treatment, systemic corticosteroids pills like prednisone might be prescribed.
Steroids by mouth.
Right. But, and this is really critical, before starting systemic steroids, the vet absolutely must rule out any underlying infections that could be causing the uveitis, because steroids can suppress the immune system and potentially make infections worse.
That's a huge point. Okay.
Yeah. The dose will be specific for the pet, and again, it needs to be tapered down gradually over time.
Okay.
You know, the fact that there are so many options, drops, injections, pills, it just highlights how complex eye inflammation can be. It lets vets really tailor the approach.
So don't be alarmed if your pet is on multiple things.
Exactly. It allows for precise targeting.
Okay, that's a lot of steroid options.
Yeah.
Are there other types of meds used besides steroids?
Yes, definitely. Topical NSAIDs, non-steroidal anti-inflammatory drugs, things like flurbiprofen or diclofenac drops can also help reduce inflammation, though it's generally thought diclofenac might be a bit less potent than the steroid drops for many conditions.
Okay, NSAID drops.
And systemic NSAIDs, pills like carprofen, meloxicam, or robenacoxib can also be used. Again, specific doses for dogs versus cats. But here's another really important point. You should never use systemic NSAIDs at the same time as systemic corticosteroids.
Why not?
The risk of serious side effects, especially stomach ulcers, goes way up when you combine them. So it's one or the other systemically.
Got it. Very important. Anything else?
Yes, one more common one is atropine sulfate, usually as drops or ointment. This does two main things. It dilates the pupil, which can actually help relieve some pain associated with uveitis.
Oh, interesting.
And it also helps stabilize the little muscles inside the eye, which again reduces discomfort from the inflammation. Just a side note, for cat owners, vets often prefer the ointment form for cats because the drops can sometimes taste bitter if they drain into the mouth, causing drooling.
A good tip for cat owners.
Yeah.
Okay, so it's often a multi-pronged attack on the inflammation for hypopyon. What about lipid flare? Is the treatment similar, or is it more focused on the fat issue?
Well, for lipid flare, you do still need to treat any uveitis that's present. So yes, topical corticosteroids like prednisolone or dexamethasone are often used and tapered just like with hypopyon.
Okay.
And if the pet seems uncomfortable, that atropine might be used too for the same reasons: pupil dilation and muscle relaxation.
Right.
But the really critical part of treating lipid flare, the part that's different, is managing that underlying metabolic disorder that's causing the high blood fat levels in the first place.
Addressing the hyperlipidemia.
Exactly. This might involve specific dietary changes, maybe medications to help lower cholesterol or triglycerides, or treating whatever other underlying condition like diabetes or hypothyroidism is contributing.
So it's definitely a two-pronged approach for lipid flare. Calm the eye down, but absolutely tackle the systemic problem.
You got it. That's essential for long-term success.
Okay. Are there any other important considerations during treatment? Things to watch out for? Medications to avoid?
Yes, a few key things. Firstly, topical miotic drugs. Those are eye drops that make the pupil smaller, should generally be avoided in both conditions.
Okay, no pupil constrictors.
Right. Also, and this is crucial, if there's any kind of open sore on the cornea, what vets call ulcerative keratitis,
A corneal ulcer.
yes, then topical and subconjunctival corticosteroids are usually a no-go. They can actually interfere with the healing of that ulcer.
Okay, steroids and ulcers don't mix.
Generally not, no. And with the atropine we mentioned, while it's helpful for pain and inflammation, it needs to be used carefully. The vet needs to monitor the pressure inside the eye, the intraocular pressure, or IOP.
Why that?
Because atropine, by dilating the pupil, can sometimes increase the risk of developing secondary glaucoma, which is high pressure inside the eye. So regular IOP checks are important when using atropine long term.
That's a really important point about monitoring pressure. What about follow-up? How often does a pet need to come back to the vet once treatment starts?
Typically, a recheck is recommended pretty quickly, usually within the first 2 to 3 days after starting treatment.
That soon?
Yeah, just to make sure things are heading in the right direction and to check that eye pressure, especially if atropine is being used. After that initial check, how often they need to come back really depends on how well the pet is responding.
Makes sense.
If things are improving nicely, the time between appointments might get longer. But if there are still significant issues or if the underlying cause is complex, then more frequent monitoring will definitely be needed to adjust treatment and catch any potential complications early.
Okay, so the big question then.
Yeah.
What's the expected outcome? If a pet is diagnosed with hypopyon or lipid flare, what kind of prognosis can owners generally expect?
Well, for hypopyon, the prognosis can really range. It could be guarded, meaning uncertain, or it could be good. It heavily depends on the underlying disease causing the uveitis and how well that specific animal responds to treatment.
It really varies.
It really does. If the underlying cause is something treatable and the eye inflammation responds well to the medications, then the outlook is generally much more optimistic.
Okay. And lipid flare?
For lipid flare, the prognosis for the eye itself is often quite good. Many cases respond fairly quickly to anti-inflammatory therapy. Sometimes within, say, 24 to 72 hours, you'll see improvement.
That's pretty fast.
It can be, yeah. However, and this is the key thing with lipid flare, it can definitely come back if that underlying high fat level in the blood isn't successfully managed long term.
So managing the systemic issue is key to preventing recurrence.
Absolutely crucial for lipid flare.
Okay. So it sounds like early detection and really getting to that root cause are vital for both of these conditions. As we wrap up our deep dive here, what's the single most important message you'd want our listeners to take away today?
I think the key message really is, if you notice any unusual cloudiness or change in the appearance of your pet's eyes, whether it looks like a distinct layer of something settled at the bottom or just a general milky haze, please get it checked out by your veterinarian.
Don't wait and see.
Right, don't wait. Both hypopyon and lipid flare can be visible signs of underlying health issues that need proper diagnosis and the right treatment. Getting help early can make a really significant difference in the final outcome for both conditions.
Absolutely. Being observant, being proactive about your pet's health, even for what seem like small changes, it can really pay off. And it makes you think, doesn't it? Especially with lipid flare pointing to those hidden metabolic issues. What other seemingly isolated symptoms we might notice in our pets could actually be clues to broader systemic health problems we're not immediately thinking about?
That's a great point.
It's definitely a good reminder to always consider the whole picture when it comes to our furry friends' well-being. Well, thanks for exploring all this with us today.
My pleasure. Always good to talk about this stuff.